Hi everyone, this is Dr. Khorasani. In this video, I'm demonstrating submental liposuction with FaceTite radiofrequency. First step is local injections of our port with lidocaine with epinephrine. Then we're using a 2mm punches in order to remove a tiny amount of skin so that we can insert our cannulas to release ports. The next step is tumescent liposuction, and this is a tumescent fluid that I'm injecting here, probably about 200 cc, and this is 0.3 lidocaine as opposed to 0.1 we use for the body. Next is a pre-tunneling that I'm doing here for FaceTite. It's important that the skin is nicely released. And note that there is no suction at this step of the process. We're just doing some pre-tunneling so that when we insert our probe, it's going to go in and out really nicely. Next is our sterile ultrasound gel here. This helps us with coupling. We inserted the probe here has an external temperature and an internal temperature, and you can set it. For instance, one of the common internal temperatures are about 64, 65, and the body you can definitely go a little bit higher. In the face, we don't really like to go more than 65. And the external temperature, usually we're trying to keep it around 38, 39, depending on the patient, depending on the thickness of the skin. And the key here is to apply very consistent passes. They all should be with firm pressure downwards, so the probe is not exiting through the skin and giving you a burn mark. The nice thing about this procedure is that the external temperature is recorded by the electrode. So once the skin gets really to a certain temperature, it definitely automatically shuts the radio frequency off. So it's a good safety mechanism to have for the face. So as you can see, I go each spot typically gets 3 passes. At that point, most of my patients I can feel like the external and the internal temperature limits have reached. So at that point, I know that we're not going to get more energy. So then I go a little bit down the neck. Again, we do 3 in a row, 3 in a row, and then so forth. And then the neck is divided into 3 zones. So the lateral areas that I just did, and then the central zone that we're doing right now. And each of these zones is supposed to get a certain amount of energy. We usually like to get at least between 4 to 5 joules in each zone of the face. Of course, it also depends on how heavy a neck someone has, how much laxity they have, male or female, but typically 4 for each side of the neck. So the 2 lateral sides and the midline, so 12 total is a good number to remember. Occasionally, in order to get to the energy levels that we desire, we may have to go back and retreat some of the areas. Once those temperatures have been reached and our energy has been satisfied, we're going to turn our focus into liposuction. So liposuction, here I'm using a 2.4 millimeter cannula. The highest I usually go in the neck is probably about 3. I use the triport cannula. Start with the midline, then go and treat the side. As demonstrated in this video, the extent of suction is pretty wide. It is the jowl area, we do the submental area, any areas medial to the sternocleidomastoid muscle is treated, and we go all the way down to the sternal notch. And once the suction is completed, we're using our spatula in order to free up any remaining skin. This is our skin flap that is being freed up right now by our spatula. And again, spatula is a very thin cannula, and the purpose of it is to just kind of really making sure that the skin is released. And then finally, we do a pinch test to assess thickness. Once we're done with the liposuction, in this case, we're also going to do Morpheus 8 because this patient has excess amount of skin laxity in the neck area. We're doing subdermal skin tightening. We're also doing external skin tightening. Here you can see us cleaning the tip after 200 pulses. Most necks require about 600 to about 1,000 pulses. We are typically doing 2 to 3 millimeter depth. Some of the areas that we can afford to melt fat, such as the submental area, we might even go up to 4. It's important to understand that this device can melt fat, and you definitely have to be careful in treating certain parts of the face to avoid chance of atrophy. Finally, we are actually suturing close our port size. Here you can see me trying to massage all the fluid to one side in order to make sure it's all drained. We've reached the end of the case. Thank you so much for watching. This is Dr. Khorasani.